Good morning, everyone, and thank you to the meeting of the IGB Audit and Performance Committee of the 25th of August 2025. First of all, I want to introduce the people sitting beside me. To my right is Mark Grant, who is deputising for Donna Mitchell, who is on annual leave. And to my left is Jessica Gould, who's the clerk to the committee, and Jackie Pepper is the chief officer to the Health and Social Care Partnership. What's here? And also on leave is Hamish Diggle. He's on annual leave, so his apologies are also noted. Can I just remind those who are joining us virtually to use the chat box to attract my attention during the meeting? And I'd also like to welcome Sandra Auld. Is Sandra online? Hello, Sandra. I'd like to welcome Sandra Auld to the meeting. She has volunteered to fill the non-voting stakeholder member vacancy. So can I ask if everyone is agreeable to Sandra taking up that role? Perfect. Thank you, Sandra. You're welcome. Did you get your papers?
I did, yes. Thank you very much.
Thank you. Bern, if you have this situation arising again, feel free to contact me directly anytime and I'll try, or Jessica, and we'll try and get it resolved for you. And if you don't have our contact information, please get that. Thank you. Are there any declarations of interest in respect to the business on the agenda today? I don't see any, so that's fine. And the first item on our agenda is the action points update. Can I ask the Chief Officer to provide an update to those, please? Oh, my apologies. I missed the minutes of the previous meeting. The minutes of the meeting of the Audit and Performance Committee of the 23rd of June. Can we agree that minute? Thank you. Are there any matters arising from that minute? Chief Officer.
Thank you, Chair. It's in relation to the lead services item, which was considered at 4.2. And since the last meeting, the three chief officers have agreed through our new lead partner forum that we will synchronise our reports and bring forward a report on lead partner services to the IJBs at the same time, and we're proposing that that would be round about December or the nearest meeting thereafter, and that will mean that we will increase our frequency in this year because you've just had a report on lead partner services, so it'll probably be a 6-monthly report, but what that will do is bring them all together at the same time, so we would intend to do that December time or the nearest meeting to that.
Thank you, Jackie. I think that'll be very welcome. To be fair, the update we had was late, I think, so that will hopefully bring things a little bit more streamlined. No other matters arising then. I'll move on to the next item, which is 3.2, which is the action points update. And again, the Chief Officer can ask you to just provide a quick update on that, please.
Yes, thank you very much. In terms of the annual overview of clinical and care governance, we have agreed to do that. It's not available to this meeting. I propose that that would come forward to our next meeting, and the will, in addition to that, agree to bring forward a briefing to the Audit and Performance Committee in relation to the new arrangements around the clinical governance framework approved by NHS side and what that means for this meeting and our approach to reporting. And in addition, we'll bring forward a schedule, a revised schedule of our reporting to both NHS side, Perth and Kinross Council, and then coming together at this committee. So we'll bring forward 3 things at our next meeting. Thanks.
Thank you. Any questions for Jackie on that update? I've just one quick question about the GELS visit. I noticed you put in a revised timescale of the 27th of October. I would hope it's done before that.
Yeah, thank you, Chair. We've got 2 dates that have been issued for members to consider, 17th of September and 30th of September, and those dates are both available for anyone who would want to attend.
Okay, thank you. Any questions on the action points update? Okay, then we'll move on to the next agenda item, which is the annual performance report. And can I ask Chris Jolly, Programme Manager, to present the report, please? Thank you, Chris.
Good morning, Chair and committee members. Pleased to present the annual performance report for 2024-25 today, which fulfils our statutory duty under the Public Bodies Joint Work in Scotland Act to publish the report by the end of July. The report is therefore presented today for formal approval. The APR provides a comprehensive overview of performance across health and social care services, aligned with the IGB strategic plan, which was approved last year, and the National Health and Wellbeing Outcomes. The APR reflects our progress against the core suite of integration indicators, supplemented by a range of measures from the Ministerial Steering Group and also a fairly broad range of local measures. Again, for additional strategic context, the IGB approved a new performance framework within the year based on the Plan, Do, Check, Act cycle. This will guide future reporting and will link directly to refreshed delivery plans for older people's adult services and primary care. These delivery plans will describe actions taken to implement the strategic priorities and include measurable outcomes, with performance being reported through this committee. In reflection on the APR itself and performance within 24-25, despite significant pressures, performance remains strong. Emergency bed days reduced, for example, by 7.6% year on year. Delayed discharge performance particularly good, with being 31% better than the national average. We did note that emergency admissions and A&E attendances have increased slightly. Addressing this, a range of service redesign is taking place currently, which will see the introduction of a single point of contact to streamline access to community services. It's hoped that this will assist in reducing unnecessary hospital visits. Service user experience is obviously important for us to understand how people experience our services. Predominantly, we use care opinions for that. We can see that ratings provided by people who have used our services have improved across all measures, with an increase in the average score of 4.7 out of 5, and also an increase of 123% in the number of ratings that we've actually received. So in terms of recommendations, the APR marks a key milestone in our commitment to transparency, continuous improvement, and delivering high quality integrated care. And the committee is asked to formally approve the report today. Following approval, the report will be presented to the IGB on the 8th of October for information and will be shared with partner organisations.
Thank you, Chris. Are there any questions for Chris in the room first, please? Councillor Illingworth.
Thank you. The report obviously derives a lot from care opinion. Do we have any comparisons with other areas that have used care opinion?
So care opinions products, you're right, is used across quite a number of different service areas. We don't have direct comparisons to other areas in respect to that tool, but we do have comparisons in respect to the Health and Care Experience Survey, which we know, albeit is only done every 2 years, but it's nonetheless statutorily required to be reported on. So we do use that methodology as well. In recognition of the fact that that is only done every 2 years, however, we are looking to take some steps to increase the frequency of which that type of response can be gathered locally to supplement the value that we get from care opinion.
Sandra, welcome. You have a question?
I do. Thanks very much. Thanks very much, Chris, for your report. Can I just ask a question about the single point of contact? I don't know if you have this information, but as an example, let's say an older person falls and presents at A&E. could you give some information about how the single point of contact, how that would be put into operation, how that would actually work?
So I'm going to ask Mrs. Robertson to come in on that in respect to the older people's portfolio. I think what I would say just in introduction to that is that there is a paper later today that describes some of the transformation work that's going on, and I'm sure Ms. Robertson will have something to add to that.
Thanks, Chris. Zoe?
Hi. I suppose I think it's fair to say that by the time that somebody presents at A&E, you've missed your opportunity to some degree. So the point of the single point of contact is I suppose to declutter what is a really cumbersome referral process at the moment. There are multiple points of contact just now, dependent on where you touch services, and the purpose of the single point of contact, as the title would indicate, is to streamline that really significantly and to ensure that people know where to go at the earliest stage. So if, for example, somebody is having falls or more frequent falls, they know where to go to at what point in their journey, and we can make sure that they get the support earlier on, is really, in essence, I suppose, a simplistic description of what that SPOC would mean. But alongside all of that, there's Tayside-wide work in and around points of referral from GP, points of referral to ambulance services. So it's really quite a complex piece of work. So we have SPOCs within our localities, within Perth and Kinross, but also SPOCs within that wider Tayside model, Sandra.
Thanks. So it's a place rather than a person.
Yeah, so
being identified.
So the SPOCs will sit within Perth and Kinross. The SPOC will be within the integrated locality teams.
Okay.
And at the moment, people can come through their GP, or they might come through our customer service route, or they'll come through access service. So there's multiple ways of accessing our services. Sometimes people are accessing our services too late in the journey, and therefore they need a more acute, for example, wraparound support. So the idea will be, and this is the nuance to it that hasn't been finalised at this point in time, is that people who live within, for example, Perth City will have a single point of contact within Perth City that they come to, at which point they will be triaged then to the most appropriate route. So they won't need to go through various points of contact to get to where it is that they need to go. And they'll get the right care, right place, time stuff, basically.
Okay, that's really helpful, and that's much clearer. Thanks so much, Zoe. Thank you.
And there is a transformation programme in and around integrated care teams and the SPOC, Sandra, which will come forward, and we'll go into more depth of detail again in further meetings.
Thank you, Zoe. Thanks, Sandra. Martin Black, please.
Thank you very much for the report, Chris. And I'll go to page 16, the point 3, the overview, in the second and third paragraph both talk about the financial challenges. And despite these financial challenges, we're coming up with good reports. What is the mitigation? Because finances will get worse instead of better. How are we going to actually maintain even at least that good? How have we got something in place? And I've got another question to answer.
Chris, do you want to say that, or Mark? They're queuing up to answer you there, Martin. Jack is going to go first.
Yeah, I think you raised a really good point there, Martin, because if, just the report that we had last week at the Integrated Joint Board around the financial position, and what we're reporting here is overall good performance. There are pockets that we still need to improve upon. So to be able to manage that, we'll have to make some difficult decisions around where would our threshold be around those areas that we may not be able to maintain that level of performance.
Yeah, just add to that, I think we would be taking that through the normal routes as well, Martin, around budget review groups, and involve all members in those discussions going forward as well. So yes, just echoing what Jackie says, and that those methods will be followed as per.
Next question, Mr. Black, please.
It was only raised about that single point of contact and single point of contact, yeah. How are we going to achieve the communication that is going to allow people to understand what a single point of contact is? It's wonderful that we've got this vision of a single point of contact, but you're out in Loch Rannoch or out in somewhere else. How are they going to understand that?
Thanks, Barton. I think that's an excellent question. Zoe, it's up for you.
Yeah, no, there'll be a full communication and engagement strategy that goes alongside this work, Martin. So we've already started drafting a communication plan around all of the work that's coming through our transformation programmes. That's going to be absolutely vital to it, because when we did our consultation in regards to the strategic plan, one of the things that people talked about predominantly was needing to understand better how to access services. And that's one of our priorities within the strategic plan alone. So there are a number of actions that we are seeking to take forward over the course of that plan as well. In terms of the financial question you just had as well, the transformation programmes that we're undertaking at the moment, you know, are seeking to redesign the way that we do deliver services, not only to make them efficient now, but over the course of the next decade. That's increasingly challenging, and there's only so much that we can do with that. But for example, the work that we've done in the last year has reduced, for example, unmet need and delayed discharge, but increased costs. We're at a point now where what do we do with that model to bring in further efficiencies again? So that's all within that planning cycle and that transformational work that we seek to undertake that.
Just in that communication strategy, I always make the plea that we include for the people, the 30% of the population that have difficulty with literacy, have difficulty with basically they can't read and write.
And good point, Martin. And I think there's also, we've talked about it before in this committee and elsewhere, about those who are digitally excluded as well, or with other types of sensory impairments that might make it more challenging. I have one question myself. It's on page 66 and 67 of our pack around the national indicators. I need to pull it back up again, sorry. On the indicators 1 to 9, I accept they're only every 2 years, but some of them, if I just pull out one that stood out for me was NI4, percentage of adults supported at home who agree that their health and social care services seem to be well coordinated. It's going in the wrong direction, I would suggest. And although these are national indicators, I'm just wondering what the thresholds are for some of these and whether or not, as part of our transformation programme, we might consider putting in place some additional stretch targets for ourselves. But I think it would be worthwhile if you can give us a bit of an update on why quite a few of these are on a downward trend. Thank you.
Yeah, thanks for the question. Yeah, there's a bit of kind of background context that's really necessary for us to understand the nature of the health and care experience survey, which sits behind these indicators 1 to 9, and that is that the way that the data is gathered for those is not directly linked to the delivery of health and social care services. So people's details are lifted from GP practice lists and are then asked a series of questions at random. And so the responses to those questions will be from people who may or may not have actually accessed health and social care services. So I think it's important that there is a bit of a health warning around the veracity of the data itself. That's not to dispel it as being invalid. It's just a health warning around that. I think the point that you're making, however, is valid in respect to the frequency at which we gather the necessary data so that we can have a better understanding of the experience of people who access services in Perth and Kinross. And when we have done that in the past through previous survey type tools that we've had in the past previously, what we found was that it was actually quite contrary to what was held within the healthcare experience outcomes. So I think, as I mentioned a little bit earlier, as we go through the implementation of our performance framework and we consider the benefits realisation of the projects that we're taking forward to transformation, we would look to be in a better position in terms of the gathering of that data on a more regular basis to answer the question that you've asked. Hope that helps.
Yes, that does help, Chris. Before I come back, I'll bring in Heather.
Thanks very much, Chair. Thanks, Chris, for the report. I thought it was a really comprehensive report. I learned a lot reading it, so thank you very much. I thought it was really clear. The question I wanted to ask really just relates to the point that Sheila has raised there with regards to data and the analysis of data, because in the report itself, when we're talking about the table that shows the performance, which, you know, when you look at the table 1 on page 31, it looks like a really stable kind of performance. There's 1 or 2 wee bits there. And 2 things. How do you reflect on our performance against the Scottish performance? Because I think there are some, you know, that do we go and visit other places to find out how they're achieving a better rate than ours? And my second point really relates to the data and the analysis that you undertake, because when we're looking at the information in the report on page 32 with regards to the A&E attendances, it says underlying causes are complex and not yet fully understood. If we don't understand what the issues are, it's really difficult to have a transformation programme to actually support change that's necessary. So I know in the risk paper later on, there's a section about data and data analytics, and I just think it's really important to understand where we are on that journey, and if we are using the data we have to the full extent, because what you've just said in response to Sheila's question makes me think, well, perhaps we're not exploiting the data to help us make the strategic decisions that we should be making. So I'm just raising that question. Thanks.
Thanks, Heather. Do you want to go back, Chris, on any of that?
Yeah, thanks very much for the question. You raised a couple of really good points. So in terms of comparisons to Scotland, we put that into the report as information. I think it's important to recognise that Perth and Kinross's characteristics, however, don't necessarily aren't particularly well aligned to the rest of Scotland in terms of a population. So as we think about the implementation of our performance framework, what we would look to do is to bring forward comparisons to other areas that are more aligned to the Perth and Kinross demography in a more sort of traditional benchmarking style, which I think will provide a little bit more context to how we're actually performing. But we've provided what we can provide for the time being, with a trajectory towards doing that differently as we move forward. And part of that will be about the delivery plans for each of our portfolios that we've described earlier: adult services, older people as a primary care, which then puts in place the types of targets that people would like to see, you know, in terms of how are we going to deliver, when are we going to deliver against it. And I think focusing on that for the time being is the area that's going to give us the most context around how well we're doing. I think that's in response to your first point. I think the second point you raised about the analytics is a very good one as well, because the data is rich. You know, there's a lot of data. The lack of data is not what we've got here at all. It's more that there's more data than you can shake a stick at, to be quite honest, if you could excuse the colloquialism. But so there is an issue around how we gather that, how we look at that, establish which bits are the most important. It can be difficult to get empirical understanding of what's going on, but what we can do is recognise the behaviours that people are experiencing, and where we can see that people are presenting at the likes of A&E but are not necessarily being admitted, and we can see that because the emergency bed days is actually going down. So what we've got is a behaviour of people going to A&E and then being turned away and be dealt with elsewhere. So that's where we're targeting the likes of the single point of contact, which can allow us a reasonable understanding that actually people are going there when they perhaps don't really need to be there. And so by creating better opportunities to engage with them earlier through those transformation opportunities, we would hope to see a better outcome. So in terms of the actual detailed analytics, it can be quite a cumbersome process and extremely detailed and quite long as well, where we're looking to actually try and make some turnaround much quicker. And I think the transformation activity that we've got, as I say, is targeted against that. So hopefully that gives some assurance as well.
Thanks. All right, sorry.
Sorry, is it on the same thing, Jackie?
Sorry. Thanks for that, Chris and Jackie. Just to say, I get the benchmarking thing, and it's interesting to me because I spent 12 years working in Ayrshire, and Ayrshire's pretty similar actually to Perth and Kinross in a lot of ways, and has a lot more deprivation in some areas than Perth and Kinross. But I think benchmarking is really useful and can help to develop new strategies and new ways of working. On the data analytics bit, I think, yeah, you can determine whatever data, but I think when we're going through service redesign and service transformation, it's really important at the outset to agree the data you're going to collect so that you can actually use that and analyse it to determine better outcomes. So I suppose I'm looking for some reassurance that says this is a really good comprehensive report, and I'm not knocking it in any way, but I would like to know for the future, because this is looking backwards for the future, are we making sure that we're preparing at the outset to gather the right kind of data to provide us with the information we need to make the best decisions?
So yeah, and we're kind of referring to the transformation paper that comes later as well, and probably refer a committee to previous reports on transformation which have described the methodology that's used. So in that respect, it's the Design Council's approach to service redesign that we seek to take within our service redesign projects, which takes that double diamond approach, which you may be familiar with, which creates a level of discipline about really discovering in that first stage not what we think the problem is, but actually what the problem is, and then through that data gathering, through that consultation, through the experiential learning of people that experience the service, and that type of data gathering is where we would anticipate the types of discovery that you're describing is probably most valuable, and can either validate or dispel what a preconceived idea might be in respect to the types of data that's actually there without having that experiential learning. So they're quite comprehensive engagement that goes on in the initial stages of these projects, and I think that's probably the place where we probably learn the most.
Martin, do you want to come in on the same point?
Probably the same point that we can't compare apples and pears. That's exactly what we can't do. And having worked in Craigmillar, Jackie will know working in Craigmillar, and if we got the data from Craigmillar and go half a mile up the road to Duddingston and get the data for Duddingston, there's just no comparison whatsoever. My argument was always, and it's like Drumchapel and Bearsden, and the very same. Where I was trying to put resources to bring Craigmillar and Drumchapel up to Bearsden and Duddingston, and because you absolutely just cannot compare data in there. That there's what is about a 5 or 6 year life expectancy in each of these areas, more in Duddingston and Drumchapel than there is in Bearsden. So I always find data, it's a great idea, but it needs to be thought better.
Thanks, Martin. I lived in Bearsden and Halls of Residence and went to teacher training practice in Drumchapel, so I know the juxtaposition of the two very well indeed, but I've forgotten about it. So Jackie, at last, I think you want to come in.
Yes, it was around the question in relation to any attendance and emergency admissions, because and then the readmissions, and your question about what's underpinning that. And there's a new piece of work that's about to kick off in relation to looking at unscheduled care, and just some data I was looking at this morning, which clearly shows that the area that's most challenging for us is within Perth City, where you've got the hospital within easy reach of most of the population, and the attendance rate is very similar to certain pockets in Dundee. So there's a piece of work about to begin with our colleagues across acute services and scheduled care and colleagues in Dundee, looking at that in particular in terms of the top 4 areas from where we've got the highest presentations. So that should take us into a deeper understanding of what are the issues that are arising for us here in Perth and Kinross. So really just to give you some reassurance around that. So that's the first time I think that that's happened. But the point about stretching targets, setting yourself a target in relation to some of these, one of the difficulties is that some of them are only reporting every 2 years. So it's quite a gap. So we have to fill that gap, and you're absolutely right. That needs to be built in from the outset in terms of any transformation work that we need to be doing, and that's something we're going to do a bit of a reset and a refresh, and you'll see that in the paper later around that. So you should see that coming forward and being able to track that and what changes we're making. Thanks.
Thank you, everyone.
So it's just to say as well, there's the joint strategic needs assessment as well as available, which is a very lengthy document, but goes into some detail about readmissions and admissions to hospital, and was used as the basis to formulate the strategic plan, and that will be due for a refresh in the next 18 months or so as well. So it's just so you don't think we're working in a void of no data, but there's multiple streams of data, and it was almost like listening to myself in the last week in terms of trying to pull data from multiple sources and cleanse it and make sure that it's the right data, and that we are, particularly in relation to financial concerns, targeting any financial recovery plans that we have correctly on the basis of that. But the joint strategic needs assessment, if you want it recirculated, is probably quite a good one just to have a kind of refresh again.
Thanks, everyone. I think this is clearly a subject that's really important, and notwithstanding this is an annual report that we have to produce and there's statutory indicators, I think there's been enough of discussion here and very valid and good questions raised that I think we need to give some consideration to coming back to this committee with perhaps some forward-looking and some more current information, particularly around the lived experience that people have and some of these national indicators, because it doesn't necessarily reflect what knowledge I have out there in the community. So maybe we need to think about how we make sure that we do have some local data to put some of the national data in context. So I think that'd be very good. So now can we move forward to accept the recommendation in the report to approve the annual performance report? Great. Thank you very much, everyone. Now we move on to item 4.2, which is a progress update on the Health and Social Care Partnership Transformation Programme. I can ask Jackie Pepper to introduce this report, please. No.
I'm just going to do a very brief introduction and sorry, my mic. Thank you. I'm just going to give a very brief introduction and hand over to Chris to say a few words as well, Chris Jolly. This is an update report in relation to the transformation programme, and the committee's been asked to note the contents of the report, but importantly note our intention to reset our transformation programme, taking account of the national direction of travel in relation to improvement and transformation set out in the Health and Social Care Renewal Framework that we were briefly alerted to at the IJB last week. So this is an update, and we have both Jane Menzies online and Zoe Robertson in the room, who have oversight of most of the transformation areas that are set out in this report. Chris, do you want to say something?
Yes, hi, good morning. It's just to say that it's, as the Chief Officer's just mentioned, this is an update report. At the outset, we set up the programme with a methodology in respect to how we manage our projects, how we establish them, and then how we monitor them. And in the intervening period, we've undertaken a self-assessment of that approach. against the Scottish Government's principles for programme and project management. There are a number of points within that self-assessment that would give us a surety that we're actually doing as we ought, but needless to say, there are a few areas that we could improve upon, and there is a programme in place to improve that approach, and that will be reported through to this committee through the Partnership Improvement Plan as we go forward. Following that, it's just to say that the programme mainly covers older people's services, and Zoe, I'm sure will have be able to pass comment on the contents of the actual projects themselves, and I'll happily support her in that if that's necessary.
Thank you, Chris. Zoe, do you want to make a comment at all at this point, or do you want to wait for questions?
Thanks for the report. See under 3.4, the integrated locality teams. Is there going to be significant training for these teams, or are we just going to say, right, we're trying to get you to all work together with a full understanding why they are and what is the purpose and what is going to be the outcomes there?
So you can take that one.
Hi, Martin. Yeah, the teams that are involved in we have one fully established Perth City integrated locality team, and that was established at the tail end of last year. But Perth City and South locality is taking slightly longer, predominantly just because of buildings, and we don't really have good, adequate, large enough buildings to co-locate everybody. But all the teams that were involved in that undertook SWOT analysis of their teams, how they were delivering their services and what they would perceive to be the benefits of working in a more integrated way, where the efficiencies were that they could find, where they could reduce confusion, pathways, etc. So a great deal of work went on with all of the teams within the different localities in the build-up to any integrated base as such. Perth City is quite lucky because a lot of people are already kind of relatively co-located, so it was reasonably easy to do that, and they did work quite closely as it was. Maybe some of the more complicated work is combining the skills of the NHS employees and the council employees because of the associated policies and procedures that the two employing bodies have. So there's been a bit of more prolonged work and required in, for example, areas like OT integration, where we have OTs that work for NHS and OTs that work for the council, and have delivered that in a quite siloed way. So that's actually taken quite a lot of time to get people to look at what their work is and how it can be shared, and acknowledging the unique skills that some people bring in both sides of those employing organisations, not losing them, but being able to merge where it's appropriate to do so. And I suppose that sort of description is where you would see that across multiple of the roles that exist, that there are skills and strengths that need to be retained within that, but where people can integrate, that's where they will do so. And I suppose one of the main benefits of it is just enhanced relationships, knowing who to go to, who does what, where, when and how, and speed of being able to access that.
Thank you, Zoe. Are there any other questions? Bernie?
Sorry, thank you. So it was just to confirm then, are the locality teams up and running? Because I know as public partners, we've raised it a number of occasions for our involvement as part of the locality teams, and certainly within our carers group, we had representatives who were, as part of lived experience, keen to be part of the group in the south and in Perth City, but nothing has materialised, and I think we do raise it at our public partner meetings. So it would be, I'll be interested to know if they are up and running, and we've actually not been informed. Thank you.
Perth City is up and running, Bernie, and has been since kind of December last year. I'm not aware of that ask, but certainly can link you in terms of north and south and any future involvement.
Thank you very much. I don't see anyone else either online or in the room with questions. I do have one, which is around the financial impact of the transformation. And I noticed we've delivered in-year savings of £12,000, which is very good. I just wanted to clarify something around the savings for 26-27, because presumably they are, I'm assuming that they'll be delivered this year for in-year savings next year. Can you give me some clarity around that?
So the savings that are referred to within that paper, they were agreed as part of the budget in 25-26 for delivery in 26-27. So we haven't reported on that through the financial paper that went to the IGB last week. In terms of delivery and where we are with those savings, I'd probably pass that on to Zoe for comment at the moment, if that's okay.
Just for clarity, Zoe, I suppose I want to get some confidence that, because we're almost halfway through the year already, that the savings we seek to deliver will be achieved as full in-year savings in time, and just how close we are, because 12,000 out of 155 isn't a huge amount if we're delivering 155,000 this year.
I don't know what the 12,000 is in relation to, Mark. Sorry. Oh.
Just to be clear, I just want to get some confidence. I don't really need to know what the 12,000 is for. I just need to get some confidence that the transformation programs we're undertaking will deliver £155,000 of savings in year, because, you know, if they're not going to be completed until the 31st of March 2026, then we'll struggle to deliver 155,000 a year.
Sorry, I maybe misunderstood your question. In relation to the 155, so within the paper that we put to the IJB last week, we have included the impact of that full 155k saving. So we are presuming that we'll make that in full, and that's included in the impact of that paper that was put to the IJB.
Okay, I think just for the purpose then for this committee, it would be a bit more granularity around that to see exactly how that's going to be phased over the years, so that this committee can have some confidence that in fact it will happen. Understand that it's in place for budget monitoring and you know, all that sort of stuff. But for the purpose of this committee, I think we need a bit more granularity so that we can get some confidence and we can understand better exactly what the challenges might be, and hopefully be able to address those and support any interventions that are required to help deliver that 155,000. Jackie, do you want to come in on this, or?
Yeah, the saving that you're referring to is the 155 in relation to integrated locality teams, which is the very piece of work that we're talking about. So we've implemented it in one area and there's two further to come forward. So it's just confirmation that will be met. Zoe.
Yeah, I'm seeing it in the annex now. Sorry, I couldn't see it. But yeah, it's aligned to integrated teams. So, and that will be a workforce saving in essence. And so, and that will be brought through efficiencies in terms of integrated locality teams. So, and we've gradually, through natural attrition, through scrutiny panels, been looking at posts as they come through, Sheila, and that's how we have to date made that saving and continue to make that saving.
Okay, I understand that. It's just, yeah, I think we need more detail for the purpose of this committee to understand, not just about one in particular, just the whole transformation programme, because you know, there's investment by the local authority and the health board to support our budget, but there was very specific investment to help deliver transformation. So I think this committee has a role to scrutinise and to be confident that A, the transformation is proceeding to plan, and B, that the savings will be delivered that were expected. So perhaps the next time this comes back, we can have a bit more granularity. Thank you. Are there any other questions? I don't see anything else or anyone else online, I don't think. Just get back online. Nothing online. Okay. So thank you, everyone. So the recommendations in this report is that we're asked to note the contents of the report, note the intention to reset the transformation programme to take account of the updated national direction for improvement and transformation arising from the publication of the NHS Operational Improvement Plan and the Health and Social Care Renewal Framework, and request an update on progress made within the transformation programme in March 2026. I would actually think I would like to have someone come back before March 2026. Because I think at that point it's just a little bit too late. So perhaps something at the next meeting with a bit more granularity around our progress to plan and the savings that are delivered and how we're getting along with that. Because then we're starting into the throes of budget setting, so March might be a wee bit late. That's okay with everybody. Everyone here. Lovely. Thank you very much. Now, so we've done that one. So now we move on to section on governance and assurance and the strategic risk management update. And can I ask Phil Gerard, please, to present the report?
Thank you, Martin. Thank you, Chair. The report presented to you today provides an update on the senior management team's work regarding the IGB strategic risks. Section 3.3 of the report highlights any changes to the risk scores. Only changes are the workforce risk, which has gone down from 12 to 9 and is now a priority 3 yellow risk, and the primary care risk, although this increased to 8 briefly, but has now since reduced back to 6. So the same score as reported to this committee back in February this year. The risk register contains 6 risks. 3 are considered out with appetite and 3 are within appetite. The work of the SMT resulted in some key updates, which are included at Table 1 in Section 3.5 of the report. These include the risk, the service demand and capacity, which is SRO6. This has now been fully defined and scored since the last committee. It has an inherent score of 20, a residual score of 15. It's classified as a priority 2 high strategic risk, but it is within the IGB's risk appetite, meaning no immediate actions are needed to reduce the risk exposure. Workforce, which is SRO3. This has decreased from 12 to 9, making it a medium priority 3 yellow risk now, and that is within the acceptable appetite. This is due to effective controls that we have in place for that risk. Sustainability of primary care services, SRO4. As mentioned earlier, this has reduced. This did briefly go up to 8 and reduced back down to 6 in July. This is the reduction back down to 6 is partly due to the resolution of the critical situation at CARS practice, where a new GP provider was successfully identified. SRO1, which is the financial resources risk. The financial risk to the IGB remains unchanged at 20. This is despite an increase in the projected expenditure based on 1.3, as reported to IGB last week. SMT are actively working on mitigation actions and the situation is being closely monitored. Performance and outcomes, SRO2. This remains unchanged as well. Improvement actions are still being implemented, although good progress is being made. A new performance framework has been approved and will be implemented during 2025-26. And finally, the whole system approach to mental health and well-being. Will I move this closer? Okay. The whole system approach to mental health and well-being, which is SRO5. This risk score also remains unchanged while improvement actions progress. The report's recommendations are for the Audit and Performance Committee to note the SMT's work in reviewing and identifying risks and to approve the strategic risk register as set out at Appendix 1. A further report on the progress of risk management will be presented to the committee in February 2026 and every 6 months thereafter. Happy to take any questions.
Thank you, Phil. Have we any questions in the room for Phil on this report? Heather?
Thanks very much. I kind of mentioned it when I asked the question to Chris earlier with regards to the data quality and availability, and I see that that's out with the appetite. I suppose this is more a comment than a question, but my comment would be, I didn't get a flavour of the actions that are being taken with regards to the risks that are out with the appetite. I got a description of things that are happening, but I didn't get any kind of indication of the actions that are being taken. So I looked further on in case it was further down, but I couldn't really see that. It would be quite helpful to understand, you know, the descriptor, but also to have something that says these are the actions that are being taken to move this from out with appetite to within appetite. I just wondered what plans you had for that.
Thank you. Phil, do you want to come back in on that one, please?
Yes, thank you very much for the question. I have attached the full strategic risk register at Appendix 1. So any actions that are associated with reducing the risk score for risks that are out with appetite are listed there. Is it more detail on what those actions or how they're progressing that you're looking for? So for example, page, if we talk about that risk that you mentioned there, on page 104 of the papers, there is 3 actions there.
I did look at that as well, Phil. I just thought that it was quite what would I wouldn't say it, I don't need granular information, but I would just like to have clear actions, and I didn't think that particularly saying that we would have a performance management system is telling me that that's going to, you know, deliver the kind of outcome that we're looking for. So it was just have, I think, clearer actions that were easy to understand, because I'm quite simple, and it's good if I can read something and just say, oh, that's what we're doing about it. So apologies if I did read this because I was really interested in all your preventative and detective and corrective stuff, but it was just the actions I felt should be a bit clearer.
I think that's really helpful feedback, Heather, and I think Phil will be able to take that on board. I think Jackie would, is that okay, Phil? Do you want to come back in, or Jackie wants to come in as well, I think?
No, I was just saying we will take that on board and have a look at it. Thank you.
Yeah, thanks. Just to echo that, because it's not that the information's not there. We've got all that detail sitting, and we review that as a management team. So, and we took the decision not to include it, but I think that feedback is helpful, and just to reassure you that it is there, and we'll find a way of including that in the next iteration of that, so we can work on that, Phil. Yep, thank you.
Okay, Heather. Dave?
It's just a comment. So SRO3 workforce, it's just to say I recently issued and collated a survey response from the independent sector on their workforce, the impact on the potential ending of international recruitment, national insurance contributions and sustainability. I know the partnership are looking at it as well, but I've shared it with the partnership for care homes, care at home, daycare and supported living, floating housing support. And there is significant concerns amongst some of the providers about the workforce in the future, very near future. But it's been shared with the partnership.
Just to say thanks, Dave. Yes, we're aware of that, and we'll take account of that in the next review in relation to the scoring here. But I think also, in addition to that, in terms of SRO 6, which is around service demand and capacity in relation to the financial report that came to the IJB last week, which is very much linked to demand and capacity. I think you'll see this review increasing that in the next report.
Thank you, Jackie. Martin?
I understand the impact that the national insurance, etc., has had on it, but we've had it. We've had it, and how we're going forward. It's going to go forward with that increase. So how do we say that's the impact, or that's what's creating the thing? But because it's fact, it's fact, and plans and everything should be adapted and produced to recognise that.
Just to say that the IGB made a decision last week that we would bring forward the Health and Social Care Partnership forward. We'll bring forward a recovery plan in terms of financial recovery plan. Part of that will need to link into what does that mean for our strategic plan and what can we realistically take forward and what do we may need to pull back from within this financial year. So that will be coming forward and we're working on that just now.
Heather?
Thanks. Just a follow-up to Martin's question, because in the annual performance report, you quite rightly identify the contribution that the third sector make. I just wondered if you've done any risk analysis on the impact that the financial position is having on the third sector and in the longer term may have on the services that are provided through the IGB, because obviously the third sector provide a lot of valuable support for the work that we do, and they are being hit quite heavily through a range of things, not just increases in national insurance and other costs, but the reduction in funding and finding it difficult to actually access funding. So I wondered what risk analysis you've undertaken with regards to the third sector and the partnership work.
I would just add into that the overseas workers visas and the reduction in those, I think, will add more pressures. Jackie?
I think you raise a really important point, because we did have the sustainability of our commissioned providers and broader than that as a strategic risk previously. And I know there was a piece of work that was carried out by internal audit, but almost that was a period in time. So I do think that's an area that we need to revisit and likely to appear here as another strategic risk. Thank you.
Thank you. Are there any other questions on this report? Zoe, you want to make a point?
It was just to say, in relation to your question, we consulted with providers in the build up to the financial year regards national insurance quite specifically and their sustainability. And it was having the biggest impact on the larger providers rather than the small local ones. The sort of Richmond Fellowship type providers, etc. And a few of those larger organisations wrote to us to speak to us about the difficulties that they were experiencing across Scotland. So it's one of those ones that, yes, we do need to look at locally, but nationally, that's something that needs to be driven definitely in relation to these large third sector providers that work right across Scotland. And the report that Dave had mentioned there was in relation to sponsorship, etc. We're very aware of the very specific providers, particularly in care at home, because we went through a care at home contract tender in August last year of the ones that were relying on sponsorship. And I have to say, as part of our procurement process, we didn't take on providers who were relying on in some respects, almost 100% sponsorship staff. So we made the decision not to do that because of the risk that brought with it. However, we do have providers who were successful, who we already had in the area, who have large numbers of people who have come through that sponsorship route. So we are aware of them and looking at that now. We know the timeframes for when those members of staff sponsorship runs out, but that's definitely a risk for us that we need to take into account. But we are, we're not kind of walking into oblivious, if you like.
Thank you, Zoe, for that. I don't see any other questions or oops. Okay, so for this report, we're asked to note the senior management team's work in reviewing and identifying risks that could impact the achievement of the IGB's strategic plan and approve the strategic risk register as set out in Appendix 1. Is that agreed? Approved. Thank you. Now we move on to item 5.2, the Partnership Improvement Plan and Update. And can I ask Phil Gerard again to introduce that report? Thank you, Phil.
Thank you, Chair. This report provides an update on the progress of the Partnership Improvement Plan. PIP combines improvement actions and recommendations from multiple sources, including internal and external audits, that any better? Okay, I'll start again. The report provides an update on the progress of the Partnership Improvement Plan. The PIP combines improvement actions and recommendations from multiple sources, including internal and external audits and the annual review of governance. Since the last report to this committee in June 2025, the committee has approved 3 new audit assignments and the annual governance statement. Following these approvals, 18 new improvement actions have been added to the PIP. The current status of the plan is there are now 18 outstanding actions, all of which are on track with a green status. There's no amber and no red actions on the plan. One improvement action, IP95 from the Joint Equipment Loan Store internal audit, is complete and will be removed from the plan after today's meeting. There's 14 actions marked as complete in the June 2025 report. These have all been removed and archived now. Section 3.2 discusses the internal audit of premises and property, and this is where it's going to get a little bit tricky, so bear with me. 7 improvement actions were identified for this plan. These are IP88 to IP94. The report says 6. Apologies, it should have said 7. Due to delay in the audit, the dates presented for approval at the June committee were all mostly passed. So on reflection, the senior management team are requesting that the committee approve new original dates for completion for these improvement actions. There are some revised dates in the appendix to the plan, but very recently SMT have discussed this and some of these dates have now changed, so we're asking the committee to approve these new dates, which I will quickly go through if that's okay. IP88. These are all under, I can see this, the vision, direction and purpose section of Appendix 1, the actual PIP. IP88. We're asking for the original improvement, the original completion date to be amended to 31st of January 2026. IP89, we're asking that is 27th of October 2025. IP90, 31st of January 2026. 91, 92 and 93, all 27th of October. And IP94, the 31st of January. We're also asking the committee to approve merging IP 89 and 93. You will see that both of these actions are the same. They appeared in the internal, the premises and property audit as under 2 separate audit recommendations. So we're going to merge those into one, meaning there would be 6 actions from that audit to be completed. Just moving on, all improvement actions from last year's best value self-assessment have now been completed and reported in the annual governance statement at the last committee. But to maintain strong governance and to continuously improve, annual self-assessments on best value will continue, and we will rotate through different best value themes rather than doing a full self-assessment of all the themes. The report concludes that significant progress continues to be made on the actions within the PIP, and we will continue to provide regular updates at each committee meeting. Audit Performance Committee are recommended to note the progress being made and to approve the new original completion dates as I went through there, and also the merging of IP 89 and 93. Happy to take any questions.
Thank you, Phil. Some of those dates you suggested are not the same as the report that we have in front of us. So can you perhaps pass those along to Jess so she has them for the minute, please? Are there any questions for Phil on this report in the room first? Don't see any questions in the room. And any questions from our participants online? Don't see anything here. Okay. Well, thank you, Phil, for that. I think there's been good progress made, and I'm glad to see there are some dates in there and that they've been refined to hopefully be achievable. So can we now move on to the recommendations? We recommended that we note the progress made towards achieving the actions outlined in the Partnership Improvement Plan, and we approve the new original dates for completion for the recommendations included as part of the premises and property internal assignment as per section 3.2 of this report. Is that all agreed? Lovely, thank you very much indeed. And now we move on to item 5.3, which is the internal audit progress report. And can I ask Jackie Clark, our Chief Internal Auditor, to present the report? Jackie.
Thank you, Chair. This report is quite brief and highlights the progress of internal audit across the organisation in delivering the plan. You'll see that there is one assignment outstanding for 2024-25, which is on the appendix, and that is the audit of lead partners, which is across Tayside internal audit, which is being led by my colleague, who is the Chief Internal Auditor for Angus and Dundee City Council. She is in the process of finalising the scope for this, and once that scope has been finalised, then my team are ready to take forward the work from the Perth and Kinross aspect. The other part from within the progress report is the plan for 25-26, which is a little more, it's a little different this year with our new internal audit standards. There's more of an alignment and more of a reliance that I'll need to place on work that's being undertaken by partners, and that's just affecting the timing for this coming towards this committee. But this should be ready once it's been fully agreed within the partnership for the next committee. I'm happy to take any questions if there are any. Thank you.
Thank you, Jackie. Are there any questions here in the room for Jackie? I don't see any questions online. So thank you, Jackie, for the report. The
Risk Maturity Plan 2020. Page 125.
Thank you for the question. That was a report that was presented to a previous committee, and it was the risk maturity was a follow-up from a previous internal audit which took place in 2020. But that is an up-to-date report, but it has been considered by this committee already. Thank you.
Thank you, Jackie. So the recommendation for this report is we're asked to note the progress made in the delivery of the 2024-25 internal audit plan. Duly noted. Thank you very much indeed. So now we move on to clinical and care governance section. And can I ask, welcome Aaron Singh to the meeting. And can I ask Aaron to introduce this report, please?
Thank you, Chair. The report in front of committee today provides members with assurance in respect to clinical, care and professional governance arrangements that are in place for the Health and Social Care Partnership. The report provides committee with a number of appendices relating to reports that have been provided to the Integrated Joint Board and NHS Tayside Clinical Governance Committee, and also Perth and Kinross's Scrutiny and Performance Committee. The appendices provide a detailed narrative on how assurance levels have been reached, and overall the reporting lines of governance seek to provide both committee today and the IJB of the effectiveness of those arrangements that are in place. The report provides detailed context to the background of care and professional governance arrangements within the Health and Social Care Partnership, which are overseen by the Associate Medical Director and the Chief Social Work Officer. The section also highlights the arrangements in place for NHS Tayside delegated services to the 3 IJBs across Tayside, which report directly into NHS Tayside Clinical Governance Committee. The committee will continue to be provided with updates of assurance in respect to effective clinical care and professional governance arrangements that are in place, and I'm happy to take any questions, Chair.
Thank you, Aaron. Are there any questions Bernie?
Thank you. I hope I'm raising it in the right section, but at the IJB last week, we had a report included on audit and performance, and I had a question. It was the lead partnership, Angus, provide, I think, primary care services, and they had a note regarding the continence advisory. I had a question in relation to that regarding Perth and Kinross, and it was regarding delays and how we monitor or manage that in P&K. I believe at the moment the current waiting list is 16 weeks for an assessment. Bearing in mind the actual situation, that could be pretty difficult for the the person themselves, apart from the carer that is maybe stressed out in that situation. Thank you.
Very delicately put there, Bernie. Aaron, do you want to respond to that, please?
Yeah, very quickly. Unfortunately, colleagues from Health weren't able to attend committee today, so I've offered to take any questions back to them and we can respond to you off table if that's acceptable. Thank you.
Can we perhaps get a written report or written response, Aaron, and have that circulated to everybody on the committee? Thank you, and for inclusion in the minute as well, please. I don't see any other questions in the room or online. Oh, Martin, sorry.
Thanks, Alan. Just if a risk is raised at this clinical governance committee, how does it transpose to us if it impacts on us? How we recognise that risk?
So if there was a risk that was escalated within the Care and Professional Governance Forum, then as you note within the appendices, that the escalation of the risk is noted within those reports. And if it was of such significance, then it would also be reported in the cover report for today's committee as well.
So, Jackie, you want to come in?
And if that was something that was of a significant nature and a strategic issue for the partnership, then we would be receiving that as a management team, and then that would escalate into strategic risk. So there would be a flow through that way.
Thank you, and I think that's a really valid point. Something I've raised at various different forums about ensuring that if there are related risks, whether you want to call them child risks or interdependent risks, I think it's really important that we capture those and identify them very clearly. Thank you. I don't see any other questions from Aaron, so we'll move on to the recommendations for this report. We're asked to note the responsibilities of Perth and Kinross Integrated Joint Board in respect of clinical care and professional governance and those of the IGB's partners. Note the arrangements in place for providing the IGB with assurance that effective and robust systems for clinical care and professional governance are in place. Note that NHS Tayside's Clinical Governance Committee received an assurance report regarding clinical and care governance in Appendix 1 on the 3rd of April 2025, for which it received reasonable assurance. An exception report was provided for the subsequent Clinical Governance Committee meeting on the 5th of June 2025, and that's in Appendix 2. Note that Perth and Kinross Council Scrutiny and Performance Committee received the same assurance report regarding clinical and care governance, and that's in Appendix 3 on the 23rd of April 2025. At the subsequent Scrutiny and Performance Committee meeting on the 4th of June 2025, there were no exceptions regarding social care services to report. We have to note that the Chief Officer confirms the effectiveness of the above systems in place in the IGB's partner organisations, and note the assurance provided by NHS Tayside's Clinical Governance Committee and Perth and Kinross Council Scrutiny and Performance Committee. Is everything duly noted? Thank you. I would just like to make one comment, if I may, Aaron and the Chief Officer. At the last Audit and Performance Committee, I think I made it quite clear that if we need colleagues from either other health and social care partnerships who are co-authors or contributors to these reports, that they're in attendance, even if it's online. I just don't think it's appropriate that we can't get an answer if we want to ask one for this particular committee. So I would just like to re-emphasise that with colleagues. And if they can't manage themselves, then send a substitute. Thank you. Right, so that's that one. So thank you, Aaron, for that report. And And I think the last item is the Audit and Performance Committee work plan. Any questions or comments on the work plan? No. So in that case, the work plan is agreed. Just the date of the next meeting, we're asked to note them and they're in the agenda for this committee. And does anybody get anything they wish to discuss in private before we close the meeting? I can take it afterwards. No. Okay, thank you. Then that brings us to the end of the business on this agenda. Can I thank everyone for your attendance? But before I do that, I think Chris has a comment he wants to make.
Yes, apologies committee for holding you back very briefly. I had neglected in the presentation of the APR to put on record my thanks to Claire McCarthy, team leader within the performance team, who did an outstanding amount of work to produce the APR, and also to extend those thanks to our very hard-working service teams and service management teams who have contributed the bulk of the content. So apologies, I neglected to say that when I introduced the report. Thank you.
Thank you, Chris. As I said, I bring this meeting to a close. I want to thank everyone for attending today, and particularly to all the officers for all the hard work and effort they put into preparing these reports and actually being able to answer all the questions, mostly. Sorry, Aaron. Because usually we do get all the answers. You know, there are people in attendance either online or in the room that can answer the questions that are raised. So I've made comment on that already. So now we formally close the meeting. Thank you, everyone.